If we knew more about our sleep, what would we do differently? Would we go to bed at a consistent time or take steps to reduce interruptions to our sleep? With Sleep Score, Apple Watch measures your bedtime consistency, interruptions, and sleep duration. Then, every morning it combines these factors into an easy-to-understand score from 1 to 100. So you'll know how to take the quality of your sleep from okay to very high. Know your sleep score with Apple Watch. iPhone 11 or later required.
Welcome back to another episode of Susan LoPresti Wellness, Mind, Body, and Soul. This is the podcast where we explore the highs, the lows, and everything in between when it comes to a woman's life, her health, and all aspects of navigating the midlife landscape. I'm your host, Susan LoPresti, and today I have Stacey Roberts with me. She is a physical therapist, an RN, an MSN, and she has over 30 years of experience helping patients live pain-free while achieving their health goals. She is a holistic master's prepared registered nurse, a musculoskeletal specialist, and a pelvic and sexual health physiotherapist, and a functional medicine specialist. Stacey owns the New You Health and Wellness practice in Wisconsin, combining cutting-edge technology, advanced manual therapy, and functional medicine to help patients attain their optimal health. Many of her patients, including herself, have avoided surgery, drugs, and injections. She is the author of The Pain-Free Formula. And without further ado, Stacey, welcome to my podcast. I'm so excited to have you here and to jump into this powerful conversation with you.
Susan, I really appreciate it.
You're welcome. You're welcome. Let's start your book, The Pain-Free Formula, a holistic approach to finally getting rid of joint pain without surgery, drugs, or injections. Has that book published? Because it said spring of 2025. Is it out now?
Yep, it came out in April of 2025, and the subtitle is Solving the Puzzle of Muscle and Joint Pain Without Surgery, Drugs, or Injections. So we just made a little bit of a tweak in that, but same type of thing.
Okay. And how are we doing that? How are you solving this problem?
Great question. So I've been, a physical therapist for, over 3 decades, and now a registered nurse, and hopefully soon getting my NP if I ever find time to get my clinicals done. And when patients kept on coming to me with pain issues, I started seeing patterns, going on. And when I came across a device called soft wave therapy, that kind of changed the way that I treat, because I've tried all sorts of different modalities for patients over the years, whether it's ultrasound or heat or electrical stim, and some of them helped and some of them did nothing. But this device, SoftWave, has really been a game changer, taking patients that I would have either struggled or would have taken a much longer time to get better, really accelerated the healing as long as it's a localized issue. So what was happening is SoftWave was doing amazing for like 70 to 80% of my patients, but there's like 20% that still weren't getting better. And I'm like, well, where is this coming from? And that's where I go into, looking at food sensitivities, how the gut is responding, what our hormones are doing in regards to pain, what our emotional stress is doing in regards to pain. So I put that all together in the pain-free formula to help people have that more holistic approach, because everybody's so different, and if it's not getting better when you're trying all the the normal things and then soft wave on top of that, there's got to be other reasons.
Right. So what is this soft wave therapy technology? What does it do exactly?
The soft wave is a type of shock wave. So shock wave since 2020, if you look at like trends on Google, has just gone up and up and up and up about people being interested in shock wave, because it's now being brought into more of mainstream. Normally it was high intensity and only used in hospitals to break up kidney stones, but then they brought it down to low intensity, and it's been phenomenal in helping things like tendinitises, arthritis, any type of low grade inflammation, help the body get rid of that and then heal more quickly. And the device that I have, soft wave therapy, in comparison to the other devices, is just much more comfortable for patients, doesn't cause trauma like some of the other devices do. And my patients absolutely love it.
Now, does this help with nerve pain as well?
It can. It depends on where the nerve pain's coming from. And that's what, if you're going to anybody with any type of soft wave device or shock wave, is they really need to look for the source of the pain. Because what happens is if they just chase the pain and treat necessarily where the pain is, especially with nerve pain,
Yeah.
they're probably missing it half the time or more. Because with nerve pain, where the pain is not necessarily where the problem is. So you want to make sure you get to somebody who understands anatomy and understands and has some good clinical reasoning to kind of figure out the source of that pain, because once the source of the pain is addressed and that trigger is taken away, amazing things will happen and healing really can continue.
So, what are the barriers to healing? Are they emotional, do you think?
Part of sometimes it can be emotional. There was one young man that I remember who came in. He was in his early 20s and he was with his mom and he had just back pain all the time. Nothing was working. Even when I used soft wave, it did very little to reduce his pain. And we started talking about just his lifestyle in general and the stress that he was dealing with at home. And then we kind of got off that topic because his mom kind of redirected the conversation.
Uh-huh.
But when we went and saw him the second time, his mom wasn't there. And we started talking more about the emotional stuff. And while I was talking to him about stress and the emotional stuff that he was dealing with, he was grabbing his shoulder where his pain was. And I'm like, does your shoulder hurt just talking about that? And he's like, yeah, I guess it does. So for his situation, the emotional aspects, cortisol hormone probably involved as well too, and that exacerbated the inflammation. So his key to unlock the secret to his pain was getting rid of that emotional stress and managing it much better. But there's other people who have differences, like there's people who've started certain medications, within a few months of starting to have pain, and then the medication was actually the source of the pain. So we had to do some investigative type stuff of, okay, is it the medication that's contributing to the pain or is it something else? But so a lot of the times the barriers to pain is not finding the right or to fixing pain is not finding the right person that's going to look at things again more holistically of all the potential causes. Our own barriers that we put up is that one is that sometimes we will say, well, I'm not going to do anything unless it's covered by insurance.
Mm-hmm.
And unfortunately, and I get that, right? I pay for insurance too, but unfortunately, some of the things that are really effective are not covered by insurance. And some of the things that are actually can be detrimental to your health and your joints are covered by insurance. For example, cortisone injections. Everybody, if you have pain, if you have an injury, people go in and get a cortisone injection. And for decades, we thought that was safe. Now the new research is showing that by getting cortisone injections, we're actually degrading the joint. We're actually setting it up to break down versus, do better. But that's still covered by insurance, even though they know that, even though the data shows that, it's still covered by insurance. So that's a barrier that we really have to get over to say, okay, well, I'm going to do my investigation and find the best person out there. And then, yeah, maybe I do have to pay cash out of pocket.
Yeah. Yeah. Let's circle back to that young man. So once he got to the emotional part of that pain, were you able to help him?
So I never had to see him again. So I didn't see him for, probably, I think I got an email from him probably about a year and a half later where he had told me that he went to college. He just reached out on his own. We had called him a couple times, but he had since moved out where he was living and just couldn't get a hold of him. And, so then he reached out to me and said he was in college and pursuing his degree and happy and no more back pain at all. And, was able to get back to working out and, was very appreciative of the candid conversation that we had together that day. So that really made a big impression on me in regard to how our mind can also, manifest pain as well too.
Yes, yes. And let's talk about the gut joint axis.
Yeah, it's very new, only probably in the last 5 years that it's been identified. So many people now have heard about the gut brain axis, right? So that we know that our gut can affect our brain, like anxiety and depression can be an issue for those who have a gut that may not be as healthy as it could be. But not many people understand that if your gut is not as healthy as it could be, and it's more of a leaky gut or what's called increased intestinal permeability. Stuff's getting in the body that shouldn't get in the body. Those molecules, one in particular called lipopolysaccharides, those can travel to the joints. And usually for whatever reason, it's attracted to an area that has been already injured. And if there's already inflammation, that lipopolysaccharides can actually degrade or wear away some of the cartilage over the bones and cause and contribute to significant arthritis or, painful tendinitises, those types of things. So we really need to repair the health of the gut to decrease the amount of lipopolysaccharides getting in the system, and then our body can heal. And SoftWave is one of the things that can help with that. And if SoftWave isn't getting the patient to where they need to be after about the third treatment, we start to look at the gut health. We start to look at hormones. But the gut joint axis is really relatively new, and it's something that we really need to start to pay attention to understand how to heal our joints, right?
Yes. Yes. So on a personal note, I have celiac disease, and I found out, I believe it was in 2012. And I was going to doctors who were telling me that at my age, because I was 42 at the time, that it was perfectly normal to feel this way. You're going through perimenopause. And I just couldn't accept that as my reality, because I couldn't even lift my hands over my head like this.
Wow.
My arms only went out this far. I had frozen shoulder. My All my joints were inflamed, and I couldn't walk upstairs. It was really, really difficult time. I was gaining weight. I was very puffy. And I finally went to a functional medicine doctor, and she diagnosed me with celiac disease. And when I changed my diet, I had leaky gut for sure, because I had all kinds of gut issues as well.
Right.
And it took about 7 months for me being gluten-free and dairy-free and just eating whole natural foods that I started to improve, and I just reclaimed my health that I had. So the gut joint access is something that I experienced it myself. So I
Yeah.
know.
And a patient just like you came to me, I would say probably 20 years ago now. She came to me to help with optimizing hormone levels because she was trying to get pregnant.
Uh-huh.
And I remember sitting with her at the first evaluation and just saying, "Have you ever been tested for celiac disease?" And she's like, "No, never." So we went and she had tested, and she had the endoscopy put down, to take a look at the small intestine. And sure enough, she had celiac disease. The doctor said the damage to the villi was about an 8 out of 10. So it was pretty significant. So she came back and we worked on optimizing her overall health and her gut and her, with her diet, getting rid of the gluten, obviously, and making some other changes. And fast forward a year, we had her on this gut reconditioning program. Now, at that time, research had come out to say that if you remove gluten from your diet, it doesn't necessarily repair the damage in your gut. So that was what kind of the research was at that point in time. And she had come to me about, like I said, about a year. And she said, "Hey, do you think the damage is gone in my gut from where it was before?" And I thought, this research just came out saying no, but I'm not sure. The only way that you'd know is if you'd have another test done. So she went to her doctor. The doctor refused to do it, but then she said she'd pay out of pocket. So she had another endoscopy done. And he said, because he was the original person, if I didn't do the first test, I would have said that you were misdiagnosed, because he said, I don't see any damage whatsoever. So what that taught us was a couple things. Number one, when you give the gut what it needs, when you give the body what it needs to heal, it can heal, right? And the other thing was I wasn't connecting the gut to joint pain before, and I wasn't seeing her specifically at that time for joint pain. It was more hormonal and brain fog and all that. But her joint pain completely went away when she changed her diet. And that taught me so much, because even as a physio, I didn't make that connection that the gut could have anything to do with your joints. But that just blew it all open for me to say, oh my gosh, absolutely. There's this connection. I didn't call it the gut joint axis at that time, but I knew that diet and the health of the gut had an impact on joints and muscles. And that's kind of led me to change foods in my own diet, check in my food sensitivities. I don't have gluten because I don't feel well on it, those types of things. And if I do have gluten, I get pain in my back and down my leg. If I don't have gluten, I don't have that pain. So
Wow.
it's pretty amazing once we make
Yeah.
those changes.
Yes. So when my doctor called me with the test results, she said, "I have excellent news for you." And I was like, "Oh, what is that?" And she says, "You have celiac disease." And I never heard of celiac disease at that point. And I go, "What's so excellent about that?" And she said, "Well, if you follow the diet that I'm going to give you and the whole protocol," and she put me on supplements and, things like that. She says, "You're going to feel 100 times better within 6 months. You should have no symptoms at all." And sure enough, she was right. So it was wonderful news because I thought I was dying at that point.
I bet. And so many people don't make the connection between diet and the way that they're feeling. And I think that's changing, right? It's changing, people
Yes.
are starting to put that together, but then you can put it together, but then you have to be willing to do it. Like sometimes I'll say to my patients, we'll do the food sensitivity testing. I use the LCAT testing because it has a bunch of good research behind it. And I'll say, okay, well, this came up and you've got to get rid of it for 3 months. And they'll be like, silence.
Yeah.
So are you not willing to give that up? And that's where they have to make that choice, right? And
Yes.
you would think, I mean, most people go, if I was in significant pain, I would do whatever I could. But sometimes when it comes to food, people are a little resistant to it. But
Yes.
when you get to the point like you were, or you get to the point like myself or some of my patients were, where you just don't want to feel bad anymore. And if this is what you can do to change it, why not, right? Why not get rid of a few things and adjust your diet in order to optimize your health? You'll still be able to have fun and go out, right? You still go out to dinner, you still do things, right, to have fun.
Yes.
Yeah, you just have to make some adjustments.
It's a lot easier now than it was back then because a lot of people, especially if I went to someone's house for dinner and I couldn't eat anything, they'd say, "Oh, what are you on a fad diet?" No, it's not
Yeah.
a fad diet. It wasn't as well known as it is today.
Mhm.
But it was an adjustment. It really was. It was difficult in the beginning. But as I started to feel better,
Mhm.
that's what motivated me to stay on this path. And I've been on it for a long time, and it's made a big difference. Also, in not just my physical health, but my emotional health as well. And I'm thinking a lot clearer, and my memory is stronger. So overall, it was an improvement.
Absolutely. And you're in your situation with celiac disease, you can't have gluten, right? It's an autoimmune issue. They know that now. Back when you were first diagnosed, probably that wasn't that clear. Some people even kind of poo-pooed it, that type of thing.
Hmm.
Now we know it's a real thing. Now the next thing is we understand that there can be non-celiac gluten sensitivity, right?
Yeah.
So, and that's what I have. So I could have gluten and it's not going to end up like what would happen if you had gluten. But if I do continue to have gluten, I feel very unwell and I just don't function the way that I want to function. So why would I have it? And it doesn't have to be gluten for everybody, gluten's not necessarily terrible for everybody. So that's where I like to do more personalized testing to see what specific issues it may be for those individuals, right, who are trying to get rid of pain.
Yeah. So the brain, this was another topic that I wanted to touch on with you. The brain and pain, how your nervous system keeps you stuck in
Mhm.
discomfort. What does
Mhm.
that mean exactly?
So when somebody experiences chronic pain, pain over 3 months or more, we actually can experience changes in our brain function, changes in the nerves in our brain, changes in the plasticity of our brain. I don't know if you're familiar with that term, but neuroplasticity means that the brain can still change, right? So that we can learn new things, we can, create new connections in the brain, right? So what can happen though is when somebody is experiencing pain for a long period of time, their brain becomes hypersensitive to that. It wants to constantly protect. So it can, for some people, it can overcorrect, right? And you can have more hypersensitivity to pain, have increased levels of pain, even if there's not much inflammation, or even if there's no inflammation in the area of injury anymore. So the brain has to kind of learn to kind of relax or make new connections to show that they're going to be safe. The person's going to be safe. So the brain can actually kind of fire up the pain signals if we're worried about continuously getting injured. Like I'll have patients think to themselves, can you picture yourself in the future without pain? And they have a really hard time imagining themselves in the future without pain. And that's because the brain continues to think of that particular activity, whether it's bending down to pick up your grandkids or getting up off the floor or, reaching for something on a high shelf, as significantly painful. So it's kind of etched into our lives, into our physiology. And then I'll ask them, can you think of a time in the past when those things didn't happen for you, right? So I'll say, was there a time, 5 years ago when you could reach or when you could bend down or didn't have any pain? I said, okay, let's go and think about those times in the past. And they still have a difficult time not feeling the pain. Like they can be sitting in the chair, not moving at all, and start to feel that pain, even when we're thinking about moments where they shouldn't have had pain in the past. Then I know that the brain has really kind of changed in regards to how it's monitoring and functioning regarding their pain. And we've got to do a little bit of work. Cognitive behavioral therapy is great to be able to kind of break those kind of patterns and really work on visualizing themselves in the future. Now I'm incorporating breath work and meditation as well, because there's really good research on that as well, to kind of calm the nervous system and calm that brain down so it doesn't react and exacerbate pain.
What do you think about hypnosis for that?
That would be great. I mean, some people, any of these interventions, whether it's
Yeah.
cognitive behavioral therapy, hypnosis, physical therapy, functional medicine, are as good as the person who's administering them. So if that person is familiar with doing it and is successful in helping people with pain, certainly that can be a tool that's utilized as well. So it really is whatever that the patient is most, I'd say, attracted to or believes in, that is likely going to be the best thing for them. But I was just at a recent meditation retreat that also was incorporating research, and they did research on the people, Dr. Joe Dispenza's retreat. They have like 2,000 people meditating at a time, and they're doing research and taking blood, saliva, urine, testing the microbiome, looking at hormones, looking at so many different things. And they're seeing that we can make opiates from our brain that's equivalent to morphine, right? We can also create that within our own body to decrease the pain as well. We just have to tap into it, and those types of things like meditation. And that's, I mean, I used to think that was like foo-foo and fringe, but that's really hardcore research now, right?
Yes.
We're
Yeah.
proving that. So our bodies have such an amazing capability. We just take those pills too quickly. And those pills can also be the things that lead us to chronic pain and the exacerbation of pain as well when they wear off. So chronic use of NSAIDs or pain meds can actually make us hurt more down the road.
Yeah. Joe Dispenza, he has an incredible personal story about his
Yes.
injury and
Yeah.
how he got well. He thought he was going to be in a wheelchair for the
Right.
rest of his life. And if you see, so you were at his
Meditation retreat. Yep.
yeah. And so he stands up straight as could be,
Oh
right?
gosh, you would never. He looks in.
Yeah.
He's in great shape. You would never know that he had such a severe back injury that he was almost not able to walk again.
Yes. So the mind is very powerful. It
Very.
really is. What is mechanics? What is that all about?
Biomechanics is basically the study of the way that we move. Okay.
Oh,
So it's, for example, in my book, I talk about my own experience with something called plantar fasciitis. So plantar
oh,
fasciitis, significant heel pain or significant pain on the bottom of the foot. And I developed that after having a knee injury that really kind of prompted me to write the book in the first place, because my biomechanics changed of the way that I was walking, the way that I was standing, because one of the ligaments in my knee was more loose than it had been in the past. So that changed the kind of the physics of how I was moving. And then my hips started to get a little weak as a result. And you don't really notice these things because, in doing my everyday stuff, I really didn't notice a change. Then all of a sudden I started developing this plantar fasciitis. And I was like, what the heck? I've treated this for 30 years, right? How am I developing this? And then I realized it was a change in the way that I was moving, that I was compensating because of that previous injury. And I did a survey of 100 women with plantar fasciitis, and 60% of them had had a previous injury within a year of developing plantar fasciitis, which just basically told me that they can potentially, again, compensate because, we still have to get up and walk and move around. And they do that by compensating around the previous injury, and then that creates another one. So biomechanics is assessing the way that we move, trying to become as functional and as efficient as possible to take the stress off of the area that's injured. And if we can take the stress off of the area that's injured, I call that a tangible trigger. If we can get rid of the trigger, then we can get rid of the pain and allow the body to heal.
Wow. I had plantar fasciitis during COVID.
Ah,
And I went to a foot doctor, and she said to me, "Are you working from home now?" And I said, "Yes, I am." And she said, "Do you wear shoes in your home?" And I said, "No, I have carpet and I'm always barefoot." She says, "I can't tell you how many patients are coming in with this. It's more than ever that she was seeing." And she felt that it was because everyone was working from home and not wearing shoes. And she told me to go buy a pair of sneakers that had, she recommended a brand. And she said, only wear them in your house so that they're clean on the bottom. And sure enough, that healed my plantar fasciitis. So I was always barefoot and I had no support on my feet. I didn't wear slippers. I was just barefoot.
Yeah,
And
that makes a lot of sense. I mean, I
yeah,
talk to my patients about shoe wear, about exactly what she talked to you about, and what I would have done as a physical therapist is just because you were barefoot, that really wasn't the main problem, but most likely your calf was tight, most likely your hip was weak because you were sitting a lot more, you weren't walking, you weren't as active as you normally were.
right.
Would have compensated because of that decreased activity that we all had to experience during COVID. So then you would have, like in my online plantar fasciitis program that I have for people, they have all the exercises that they need. We talk about footwear like that. We talk about soft wave therapy. We talk about all the different tools and gadgets that are out there and which ones are good and which ones aren't for plantar fasciitis. But yeah, that makes a lot of sense to me what you experienced for sure.
Yeah, I would love, Stacy, if you could give me the links to that, so
Okay.
I could put that in the show notes of the
Okay, we'll do.
podcast.
Absolutely.
Yeah, that would be great. That would be great. Stacy, any final thoughts that you'd like to leave the audience with today?
I really just like to tell people that pain doesn't have to be a life sentence. And when I say pain free, I don't mean that I don't want you to ever have pain because pain can help you, right? It can keep you from burning yourself. It can keep you from,
Yes.
getting your, I don't know, finger caught in the door, right? I want you to feel pain that can help you, but pain doesn't have to take over your life. And that's what I mean by pain free formula is pain that can be manageable or pain that's felt every once in a while, but something that doesn't necessarily take over your life. And you can achieve that. You just have to keep looking and looking for a more holistic approach if what you've done so far hasn't worked. So I hope that everybody listening, it gets moving towards a pain-free life as soon as possible.
Do you recommend that people move their bodies on a regular basis and be flexible and keep themselves limber? Especially as we're aging, doesn't that also help with pain?
Yeah, movement is great, but movement in the right ways is even better. So, for example, I see a lot of patients who go play pickleball, which is
Oh,
great. Moving, they're doing all that, right? COVID was another thing that kind of sprung that up all over the place.
yes.
But what happens is they don't, like you talked about, be limber. They don't become more flexible. And because it's a relatively, I don't want to say easy because you can get pretty intense with pickleball, but it's a relatively straightforward sport that many people can play. They don't prepare their bodies for it. So they're not stretching their shoulders, they're not stretching their calves, they're not stretching their hips, they're not strengthening those areas as well too. And then they end up with injury.
Yeah.
So absolutely we want to have movement, but we want to have movement in a body that does have the flexibility and stability and strength that it needs to keep you being able to do what you want to do for as long as possible.
Yeah, I'm glad you mentioned pickleball because it is a big sport. Everyone is into it these days, but there are a lot of injuries that are associated with pickleball.
Absolutely. I think I need to do another online program just for pickleball
Yeah.
players.
Yes. Okay. Stacy, thank you so much for being here today. You offered so much valuable information. I think it was great. And I appreciate everything that you're doing. I will put the link to your book also in the show notes and any other links that you think would be helpful. If you could send them to me, I'll add them to the show notes as well.
That's wonderful, Susan. Thank you again for the opportunity. This was a blast. I really appreciate you having me on.
Yes, and I'd love to have you come back again. Thank you. Okay, Stacey, take care.